Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live and today we are before treatment live, and today date is 17th of June 2024, and in the future we are going to be do the post treatment lives. To watch the post treatment live, please subscribe our YouTube channel, press the bell icon. So that will be doing after 8 days. तो नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं। आज डेट है 17 जून 2024 और भविष्य में हम लोग 8 दिन के बाद ट्रीटमेंट के बाद भी लाइव होंगे। तो आप लोग पोस्ट ट्रीटमेंट लाइव अवश्य देखें और उसके लिए आप हमारे YouTube चैनल को सब्सक्राइब कर सकते हैं और बेल आइकन को प्रेस कर सकते हैं ताकि नोटिफिकेशन भी मिल जाएगा। तो इस लाइव में जो है जिन पेशेंट का हम लाइव में जिन पेशेंट को देखेंगे उसकी तरफ एक बार कैमरा टर्न कर रहा हूँ। द पीपल those will be watching or listening their voice before treatment, and these are the guys who has come from different places. Actual number of patients are more, but few are not comfortable with the video, so I will not be able to show them in the live. So in this live, the topic which we are going to cover will be, I will just telling one by one. First will be introduction about me, then will be about our center, then I'll be talking about our YouTube channel. Then in fact you will be listening the patient's voice before treatment, and today date is 17th of June 2024, so you'll be listening their voice, and then I'll be talking on what are the information required before starting speech therapy. तो speech therapy start करने से पहले कहीं भी किसी भी सेंटर पर किन बातों के बारे में जानकारी जुटानी चाहिए उस पर हम बात करेंगे, and then I'll be talking on kind of services we provide. Then I'll be talking on high pitch voice signs, symptom, cause and treatment, and then I'll be talking on vocal cord paralysis, signs, symptom, cause and treatment. Then we'll be talking on is there any side effect of voice therapy or self-treatment. Next will be how to contact us, and then I'll be talking on do we have accommodation facilities at our center. Next will be which treatment is preferred first, voice therapy or surgery for pitch correction. Next I'll be talking on do we have any branch of our center. Then we'll be talking on cost and duration of the treatment for voice and speech disorder. Then will be how do we treat international patient online or offline. Then I'll be talking on is saying 1, 2, 3 or saying in your voice is the stage of treatment or end of the treatment. Next will be is voice therapy result is permanent. Then will be effect of food and drink on voice. Then I'll be talking on announcement of next batch of group therapy. तो नेक्स्ट बैच हमारा ग्रुप थेरेपी का जो स्टार्ट होने वाला अभी अनाउंस कर दे रहा हूँ, दैट विल बी ऑन 1st July 2024. So we'll be starting our next batch of group therapy on 1st July 2024, and then I'll be talking on who are the good candidate for voice therapy. Next will be is all high pitch voice or female voice is Puberphonia, and then online facilities for communication disorder at our center. Then I'll be giving few tips to keep your voice healthy, so please be connected with us. And then I'll be replying the question from the live chat. So let's move one by one. So first is introduction about me. So my name is Sanjay Kumar. By profession I'm a speech language pathologist and audiologist, and I have studied from AIIMS Delhi, from All India Institute of Medical Science New Delhi. I did my Bachelor of Science Honours in Speech and Hearing, and I have done my post graduation from University of Mysore, and my post graduation degree name is Master of Science in Speech Language Pathology. And my area of interest, you can say my passion is treating voice disorder. And of course at our center we do hearing evaluation and hearing testing, hearing aid dispensing, hearing aid fitting as well. So this is a small introduction about me, and then is our center. Our center name is Sanjay Speech Hearing and Rehabilitation Center, that we started in the year 2010. From then onward we are working in the non-surgical management of communication disorders, and our client list include people across the globe. So from all the continent, people either online or offline mode, they have taken treatment from our center. तो दुनिया का ऐसा कोई भी महादेश छूटा नहीं है जहाँ से लोग हमारे सेंटर से या तो ऑनलाइन मेथड से या ऑफलाइन मेथड से ट्रीटमेंट नहीं लिए हों। और हम अपने जो है अवेयरनेस क्रिएट कर रहे हैं पूरी दुनिया में सक्सेस स्टोरीज बिफोर एंड आफ्टर ट्रीटमेंट के माध्यम से अपने यूट्यूब चैनल का सहारा लेकर के। So this is a small introduction about our center, and our YouTube channel name is SLP Sanjay Kumar Voice Therapist. So I'm just turning the camera. So this is our YouTube channel, and that we started in the year 2010. In fact अभी जो thumbnail में दिख रहे हैं वो पेशेंट भी इंटरनेशनल पेशेंट ही हैं, तो हमारे दुनिया के हर महादेशों से लोग ट्रीटमेंट हमसे ले लिए हैं। और So we started our YouTube channel in the year 2010, and with the success stories before and after treatment videos, we are creating hope across the globe, having different voice disorder and other communication disorder. And if you want to understand our YouTube channel better, you can just explore our playlist. You'll find more information before and after treatment video, how much time it took to correct particular disorder and how much changes it happened. So we have categorized different communication disorder once you explore our YouTube channel playlist. So this is about our YouTube channel playlist, and then is you'll be listening patient's voice before treatment, having different voice disorders. So before that, I'll be informing what are the information required before starting the speech therapy in स्पीच थेरेपी. तो स्पीच थेरेपी स्टार्ट करने से पहले किन बातों के बारे में जानकारी जुटानी चाहिए, इस पर हम एक बार बात कर लेते हैं. फिर हम पेशेंट की वॉइस को सुनाएंगे जो ट्रीटमेंट के लिए आए हैं हमारे सेंटर पर. सो व्हेन यू आर गोइंग टू स्टार्ट द स्पीच थेरेपी, फर्स्ट ट्राई टू फाइंड आउट द पर्सन फ्रॉम whom you are going to take the treatment, what degree they have in the speech language pathology or audiology, what is the full form of the degree, from which college they have studied, he or she has studied, and what is the name of a speech and hearing college or medical college, which year he or she got the degree. So try to explore all this information because there are so many healthcare quacks, they will misguide you. तो कभी भी अगर आप स्पीच थेरेपी लेने जाते हैं तो पता कीजिए कि जिनसे आप थेरेपी लेने जा रहे हैं उनके पास क्या डिग्री है, डिग्री का फुल फॉर्म क्या है, कॉलेज जिससे उन्होंने पढ़ाई की, मेडिकल कॉलेज या स्पीच एंड हेयरिंग कॉलेज, उसका नाम क्या है, किस वर्ष डिग्री प्राप्त की, इन सारे चीज़ों के बारे में डिटेल में खंगाली है. और एक और मेथड में बताने जा रहा हूँ जिससे कि कोई भी आपको बेवकूफ़ नहीं बना सकता. और कौन से ईयर में डिग्री प्राप्त की ये भी पता करने की कोशिश कीजिए. कई बार झोला छाप किस्म के लोग सारी इन्फॉर्मेशन फेक दे देंगे, लेकिन एक ऐसा चीज़ है जो फेक नहीं दे सकते हैं. कोई भी जो लोग जो रिहैबिलिटेशन फील्ड में काम करते हैं, दे विल बी हैविंग RCI CRR नंबर. So either they are working as a speech language pathologist, audiologist, or psychologist, special educator, or a speech and hearing technician, ear mold technician, whatever it is. So just try to find out in which professional form they have registered in the Rehabilitation Council of India, what CRR number they are having. तो अगर मेरे CRR नंबर के बारे में जानने की उत्सुकता है तो इस वीडियो के डिस्क्रिप्शन में जाइए. If you want to know the my CRR number, please refer the description of this video. And now I'm going to tell you the step-by-step process. You can find out who is the professional and who is the fake. तो स्टेप्स मैंने इसमें बताए हैं, आप इसको ध्यान से देखिए. तो ये है फर्स्ट स्टेप है कि ये रिहैबिलिटेशन काउंसिल ऑफ इंडिया का वेबसाइट है, भारत सरकार का, गवर्नमेंट ऑफ इंडिया. वंस यू क्लिक देन यू कैन गो टू द CRR, then you can scroll to the CRR registered, then you can go this step, click to search by CRR number, then you can put CRR number here. So you'll be thinking where I can find the CRR number. So those will be the real professional, they will inform about their CRR number also. Like example for me, if you want to know my CRR number, you can go to the description of this video. So the same way you try to find others person's CRR number. If they are not giving CRR number, they are not mentioning the college, degree, which year they got the degree, they may be the fake. So be smart and be careful. And once you enter CRR number, if you will submitting here, then you will get the registration status. You will be able to find, you will find qualification and registered as. So having CRR number itself, it's not a proof that the person is a speech language pathologist. He should be registered as a speech language pathologist, because other professional who are working in the rehabilitation field, they may also having the CRR number. For example, if the person is registered as a special educator, so he should work as a special educator. If some person is registered as a psychologist, so he'll be working as a psychologist. If some person is a technician, so he'll be working as a technician. So if he is working as a speech language pathologist and audiologist, so he should be registered as a speech language pathologist and audiologist. So if you follow all these steps, and this I have written in the community page of my YouTube channel, so you'll find all these steps. And when you are taking wrong treatment by the wrong professional, there is a chances you may damage your voice and vocal cords. There are many patients who come to our center, they will be developing the vocal nodule, phonatory gap, sulcus vocalis, muscle tension, dysphonia because of the self-treatment or treatment by the healthcare quacks. So be smart. Your health and the voice and the vocal cords are very precious. एक सिंपल सी बात है कि जब आप अपने बाइक में या कार में पेट्रोल डालने के लिए जाते हैं तो पता करते हैं कौन सा पेट्रोल पंप वाला अच्छा पेट्रोल देता है, तो अपने वॉइस और वोकल कॉर्ड को कैसे किसी अनाड़ी के हाथ में दे देंगे. सो बी स्मार्ट. सो दिस इज़ फॉर अवेयरनेस पर्पस, बिकॉज आई एम ए स्पीच लैंग्वेज पैथोलॉजिस्ट एंड ऑडियोलॉजिस्ट, एंड इफ समवन इज वर्किंग इन माई फील्ड एंड हु इज ए हेल्थ केयर क्वैक, माई रिस्पॉन्सिबिलिटी इज ऑल्सो देयर टू हाउ टू एक्सपोज देम. सो यू कैन जस्ट, this is the step how you can find out. And the next is you'll be listening patient's voice before treatment. So I'll be calling first Ranjan. So Ranjan, please come here, and we are live at our YouTube channel. Please take this chair. So today we are before treatment live. In fact, we'll be doing post-treatment live as well. So those who are watching this live, and don't forget to watch the post-treatment live. So Ranjan, tell what exactly problem you are facing, why you came here. Yeah, we are live at our YouTube channel.
Sir, if someone asked me that...
keep telling na. So what happens? Someone asked then. Tell in Kannada, what is the problem you are facing?
Sir, when I ಯಾರಿಗಾರು ಫೋನ್ ಮಾಡಿದಾಗ ಲೈಕ್ ಅವರು ಫೋನ್ ಎತ್ತಿ ಹಲೋ ಮೇಡಮ್ ಹೇಗಿದ್ದೀರಾ ಹಾಗೆ ಹೀಗೆ ಅಂತಿರ್ತಾರೆ. ಸೊ ಮತ್ತೆ
So when you are calling on the phone, other side of communication partner will be telling hello madam, आप कैसे हो?
ಕೇಸೆ ಹೋ.
अच्छा. So what happened because of this?
ಸೊ ಅಂತ ಹೆಸಿಟೇಟ್ ಆಗುತ್ತೆ.
So that is affecting your confidence and it's creating more
Yes, yes,
hesitation. तो इनका ये कहना है कि जब भी फ़ोन पे बात करते हैं तो लोग मैडम बोल देते हैं, मैडम आप कैसे हो समथिंग, तो इनसे आपके उसके वजह से इनके कॉन्फिडेंस पे इम्पैक्ट पड़ता है. और हम लोग 8 दिन के बाद इनके पोस्ट ट्रीटमेंट लाइव करेंगे और देखिएगा कि इनका कॉन्फिडेंस कैसे बदल गया है. थैंक यू सो मच. और नेक्स्ट आई विल बी कॉलिंग एंड यथार्थ, या वी आर लाइव एट आवर यूट्यूब चैनल. फ्रॉम विच प्लेस यू केम, व्हाई यू केम? वी आर बिफोर ट्रीटमेंट लाइव टुडे.
Yes, sir. I'm Yatharth. I came here from Karnal, Haryana. So the problem I'm facing right now is left vocal cord paralysis.
Since how long?
I got this problem from 9 years.
9 years. So before coming here, have you taken any treatment?
I had gone for voice therapies at home.
At your hometown?
Yes.
Okay, and fine. So thanks for coming from so far distance in Bangalore, Karnal, Haryana. It's near to the Delhi NCR, no?
Yes.
Okay. I think your laryngoscopy also has been done from one of the famous hospital from Gurugram. I think I saw that, and one vocal cord is paralyzed. So there you have not taken the voice therapy?
Yes, they provided me the exercises that I have to perform at home.
Okay. So where the laryngoscopy was done in that hospital, they gave some home exercise?
Yes.
Okay, fine.
So after that I didn't see any changes, so I decided to come here.
Okay. And in the Karnal also you took treatment, and in Gurugram, both the places?
In Karnal only for 2-3 days.
Okay, but mainly you have taken in Gurugram?
Yes.
Okay, fine. So in fact, your treatment will be not be completing in 8 days. So we'll be doing hybrid mode treatment. 8 days we'll be treating here, and then we'll be giving some online programs. So okay. So those who are watching this video, if you want to see how much changes was done after 8 days, please subscribe our YouTube channel and press the bell icon so that you can watch the changes in 8 days. And once we complete whole treatment, then also I'll combine first day video, then 8th day, and then at the end of the treatment.
That will give a clear.
Yes, sure. And those who want to know that how much changes happen in the vocal cord paralysis patient, so in our YouTube channel we have created one special playlist for the vocal cord paralysis patients. So please explore that to know the detail. So thank you. I'll be calling next patient now. Shashi Kiran. Yeah, Shashi Kiran is facing some voice. Yeah, please answer. So Shashi Kiran, we are live at our YouTube channel. What challenges you are facing? We are before treatment live today.
Yeah, actually, my voice I feel is a little low and not deep enough. So I'm little conscious about my voice, and I think that sometimes I think that maybe people don't like my voice or they don't respect my voice.
So your problem is not very big, a small problem. I can say
Yes.
that your pitch was within normal limit, but extreme end of the normal.
Yeah, around 152.
152 hertz.
Yes.
Yeah, but
So-
still we'll work and we'll see the
So,
changes. And those
yeah.
are the curiosity what changes has happened after 8 days. Don't forget to watch the post treatment live.
Yeah.
So thank you so much.
Thank
And please answer. तो अब हम बात करेंगे जो भी पेशेंट वीडियो के लिए कंफर्टेबल थे उनके वीडियोस मैंने दिखा दिए हैं, और अब हम उन क्वेश्चंस पर आते हैं जिसके बारे में मैंने स्टार्टिंग में बताया था, जिस पे हम लोग चर्चा करेंगे. एंड काइंड ऑफ सर्विसेज वी प्रोवाइड. Next topic is kind of services we provide. To understand the kind of services we provide, my suggestion is that please explore our YouTube channel's playlist. So once you explore our YouTube channel playlist, you will find different kind of communication disorder and for example vocal cord paralysis, puberphonia, high pitch voice, stammering, misarticulation, aphasia which happen after the stroke, functional aphonia, functional dysphonia, sulcus vocalis, phonatory gap, and so that will help you to understand how much changes happen for a particular problem and for a particular patient, how much duration it took, and so that this will give you better information. So my suggestion is please explore our YouTube channel playlist to understand. In fact, we do hearing testing, hearing dispensing. So after fitting the suitable person to suitable hearing aid, how the communication improved, that also you will be able to find. So next is kind of services provided. After that we have a high pitch voice sign symptom cause and treatment. तो हाई पिच वॉइस का साइन सिम्टम समझना काफ़ी आसान है. जैसे कि अगर कोई एक लड़का है एंड एज इज़ मोर देन 13 years 14 years and when he is calling on the phone, people are telling yes ma'am something, they are thinking he is a small boy or a girl, so it can be a symptom of high pitch voice. So and next is high pitch voice sign symptom cause and treatment. So before discussing cause and treatment of high pitch voice, first I want to talk on normal speech production mechanism, and once you understand the normal speech production mechanism, it will be easier for you to understand the abnormal. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. And when we breathe out, you put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. These are known as articulators. So once you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sound generate, we modify that sound into different sound. In one sentence, there are so many words, in each word there are so many sound, each sound is own place, own manner of articulation. For example, if you want to say pa, both the lips are coming closer together and touching each other. When you want to say ta, tongue is coming between the teeth. When you want to say ka, back of the tongue is getting elevated and touching the soft palate. So each and every sound has own place and own manner of articulation. So it is a little complex process, the speech production mechanism is. So in this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination of this muscle goes, fluency will be affecting. If place of articulation is wrong, a manner of articulation is wrong, there will be pronunciation problem. So as I told you, here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So during puberty, in case of boys, vocal cord mass length increases due to a hormone called testosterone. If vocal cord mass will increase, length will increase, pitch reduces. In a simple manner, like before puberty, either it's a boy or a girl, there will be no much difference between the vocal cord of a boy or a girl. But in case of boys, the vocal cord mass will increase, length will increase due to a hormone called testosterone. So before puberty, vocal cord is behaving like a thin string of a guitar, like a structure in case of boys. But after puberty, due to the testosterone hormone, it becomes more thick. So it will start behaving like a thick string of a guitar, like a structure. So when the guitar string is thin, the pitch will be higher. When the guitar string will be the thick, pitch will be lower. So here we had a first patient here in this live, Ranjan. His pitch is very high. Okay. So what could be the reason? Because from childhood to puberty, Ranjan spoke in a high pitch voice. During puberty, vocal cord mass got increased, length got increased. It was ready to produce the low pitch voice. But he has used the high pitch voice from childhood to puberty. So there is a history of using almost 13-14 years of a high pitch voice. And now vocal cord is ready to produce the low pitch voice. But because of so many years habit, he found difficulty to switch on to the new voice. So what he did, to maintain his childish voice, because vocal cord has become thick, and if he use the vocal cord completely in a proper manner, then the pitch will be lower. But he wanted to hesitate, he wanted not to use the low pitch voice because of the long years habit. What he did, instead of vibrating the whole mass and the whole length of the vocal cord during puberty, he started vibrating thin edges of the vocal cord. So now actually the vocal cord is a thick string of a guitar like a structure, but behaving like a thin string of a guitar like a structure. When the guitar string will be thin, the pitch will be higher. So that's why when he is calling, his age is, I think, what is his age? Age?
21.
So now his age is 21 years, but still he is using his childish voice. Why? Because instead of vibrating the whole mass and the whole length of the vocal cord, he is vibrating thin edges of the vocal cord. So what I'll be doing to solve the problem? If I will stimulate whole mass and the whole length of the vocal cord, so if it start vibrating instead of thin edges, whole mass, whole length of the vocal cord is started vibrating after the voice therapy. The vocal cord today it's behaving like a thin string of a guitar like a structure because only thin edges are vibrating. But once whole mass and the whole length will start vibrating, the vocal cord will start behaving like a thick string of a guitar like a structure. And when the guitar string will be the thick, the pitch will be lower. So this is the biophysics of this problem, and it will be a kind of magic after 8 days. So those who are watching, don't forget to watch this magic. And but all the cases are not like Ranjan. Sometime what happened, suppose I did my evaluation, and based on that I can say that changes are going to be very nice. Sometime what happened during puberty, the like puberphonia will happen, and it has not been treated for long years, or it has been treated by a wrong method, by the self-treatment or by the healthcare healthcare quacks. So what will happen? It will be a condition of vocal abuse. So vocal abuse sometime may result into the phonatory gap and sulcus vocalis. So when the patient come with the sulcus vocalis phonatory gap, I'll be not be able to help too much. इसके लिए अगर आप जानना चाहें तो हमारे YouTube चैनल के प्लेलिस्ट को एक्सप्लोर कर सकते हैं. You will find in the sulcus vocalis phonatory gap there are not much impressive results, but it will also look like a high pitch voice only. So my suggestion is, I want to create awareness. Even you can share this to the social media, those who are watching. Like if you have a puberphonia during puberty, take treatment from a right professional. Don't do the self-treatment. Don't take treatment from the healthcare quacks, because if you will damage your vocal cords, and if it result into the phonatory gap, muscle tension dysphonia, sulcus vocalis, people like me will not be able to help you much. And sometime what will happen, the patient will take treatment from one healthcare professional, for example speech language pathologist, and it will not helpful, then they will start thinking to go for thyroplasty. So my answer is here, immediately you don't go for thyroplasty, because after thyroplasty also you have to take voice therapy. People from USA come to my clinic, from UK also people come to take treatment from my center. What do you think that in UK and US there are no speech language pathologists? Of course they are. So why they came here? They got treated. In fact, they tried there and they were not able to treat it. The reason is I'm Superman? No, not at all. Speech language pathology field is a very broad field. In this field, there are few speech language pathologists. They will be working in the area of dysphagia, swallowing disorder. Few will be working in the delayed speech and language among children. Few will be working in neurogenic communication disorder like aphasia, dysarthria. Few will be working like in the fluency disorder like stammering. Few will be working in the articulation disorder more, and few people like experts will like me, they will be more interested in the voice disorder. So for example, a voice patient has gone to a speech language pathologist or who was more expert in treating child language disorder, delayed speech language among children, or swallowing disorder. So if we'll go to that places, maybe the voice therapy will not be that much effective. But once we go to the expert who are really expert in the voice disorder, they are also speech language pathologists like me, but they are expert in the voice disorder, then if there is no change after voice therapy, then you should think about the thyroplasty. But immediately if therapist has not helped, so don't get disappointed. I am not meant for the like voice therapy. No, you have to find a right professional who are expert in the voice disorder. तो कहने का मतलब ये है कि जो अमेरिका से लोग आते हैं यहाँ पे ट्रीटमेंट के लिए, या फिर इंग्लैंड से लोग भी आए हैं यहाँ पे ट्रीटमेंट के लिए, यहाँ पे फ़ायदा हो गया और लंदन में फ़ायदा नहीं हुआ, तो क्या मैं सुपरमैन हूँ? बिल्कुल नहीं हूँ. वहाँ पे जिनसे उन्होंने ट्रीटमेंट लिया था, हो सकता है कि वो स्पीच लैंग्वेज पैथोलॉजिस्ट ही हों, लेकिन वो दूसरे कम्युनिकेशन डिसऑर्डर के एक्सपर्ट रहे हों, वहाँ फ़ायदा नहीं हुआ. मैं वॉइस डिसऑर्डर का एक्सपर्ट हूँ तो यहाँ पर हो गया. और कभी भी अगर आप थायरोप्लास्टी के लिए जाते भी हैं, सर्जरी कराते भी हैं, तो सर्जरी के बाद, थायरोप्लास्टी के बाद पिच करेक्शन हो या वोकल कॉर्ड पैरालिसिस में भी वॉइस थेरेपी लेनी ही पड़ती है. तो मेरा ये मानना है कि पहले वॉइस थेरेपी क्यों ना ट्राई कर लिया जाए. सर्जरी अपने आप में वॉइस थेरेपी के बिना अधूरा है, लेकिन अगर आपकी बॉडी रिस्पॉन्ड करती है वॉइस थेरेपी में तो ये अपने आप में कंप्लीट हो जाएगा. तो पहले वॉइस थेरेपी ट्राई करनी चाहिए. ये मेरी कोशिश रहती है अवेयरनेस के लिए. तो हम बात कर रहे थे हाई पिच वॉइस साइन सिम्टम कॉज एंड ट्रीटमेंट पे हमने बात किया. Next is vocal cord paralysis, sign, symptom, cause and treatment. So there is one patient, Yatharth, no? Yeah, Yatharth has come from Delhi NCR, we can say that. Karnal, I think it's near to that area only. तो ही इज़ हैविंग वोकल कॉर्ड पैरालिसिस. तो इस पर भी थोड़ा बात करते हैं. जैसे कि हमने स्टार्टिंग में बताया था कि हियर वी हैव लैरिंग्स, इनसाइड द लैरिंग्स वी हैव टू स्ट्रिंग लाइक अ स्ट्रक्चर्स नॉन एज वोकल कॉर्ड्स. सो व्हेन वी स्पीक द वोकल कॉर्ड्स विल कम closer together, like if I'm saying this is coming closer, and at the same time it's a vibrating also. So the nerve which supply to the vocal cord technically we call recurrent laryngeal nerve. That is a branch of 10th cranial nerve, where technically we call vagus nerve. So what happens sometime during thyroidectomy, thyroid surgery, sometime during cardiac surgery, sometime during infection or like bacterial infection, viral infection or trauma, that nerve gets damaged. For example, if the left vocal cord nerve which is supplying to the left vocal cord is getting damaged, then there will be left vocal cord paralysis or paresis. तो अगर yours is which vocal cord is paralyzed? लेफ्ट. तो अगर यथार्थ के केस में लेफ्ट वोकल कॉर्ड पैरालाइज्ड है, तो क्या हो रहा है कि जैसे अगर यथार्थ कुछ भी बोल रहे हैं, इफ इज सेइंग तो राइट वोकल कॉर्ड इज कमिंग टुवर्ड्स द लेफ्ट बट लेफ्ट इज नॉट कमिंग. सो नाउ व्हाट इज हैपनिंग, देयर इज द एयर गैप, टेक्निकली वी कॉल फोनेटरी गैप इज जनरेटिंग. व्हेन वी स्पीक वी पुट एयर प्रेशर बिलो द वोकल कॉर्ड टू वाइब्रेट द वोकल कॉर्ड, एंड नाउ द लेफ्ट इज नॉट मूविंग, सो there is a gap between the vocal cord, air is escaping. So the amplitude of vibration of the vocal cord is less, because the air which is putting below the vocal cord is creating the region to vibrate the vocal cord. Now air is wasted, so the amplitude of vibration of the vocal cord will be less. So when the amplitude will be less, loudness will be less. इसको सिंपल वे में समझते हैं कि अगर कोई भी गिटार है, अगर उसको जोर से बजाना है, तब क्या करते हैं, ऐसे करके जोर से खींच दिया, आवाज़ जोर से आई. क्यों जोर से आई? बिकॉज दैट वाज द एम्पलीट्यूड ऑफ वाइब्रेशन वाज मोर. So if we'll be doing very less with the less energy, the loudness will be less because amplitude of vibration is less. So here air is getting wasted. So that's why in the vocal cord paralysis patient the loudness will be less. Second thing is air is coming between the vocal cord. So air is coming out. So voice will be breathy. So one symptoms of the vocal cord paralysis patient will be loudness will be less, voice will be breathy. And because both the vocal cords are not in unison, also there will be hoarseness as well. So I was talking about the vocal cord paralysis, sign, symptom, cause and treatment. So let's talk about the treatment. So what I'll be doing in the treatment of the vocal cord paralysis and the dysphonia. I will first try to move the left vocal cord in your case, which is paralyzed. In the Yatharth case we can say that. So in Yatharth case I will be trying to stimulate the left vocal cord with the voice therapy. So once the left vocal cord will start vibrating and it will start coming closer together, air gap will reduce, the voice quality will improve. Like phonatory gap will reduce, amplitude of vibration will increase. There is chances that left vocal cord will not able to stimulate. Then what we can do, we can bring the right vocal cord more towards the left. Then also we can reduce the phonatory gap. Once the phonatory gap will reduce, the voice quality will improve. So this is the biophysics behind the vocal cord paralysis, and we spoke about the vocal cord paralysis, sign, symptom, cause and treatment. Next is stammering, sign, symptom, cause and treatment. So in this live, stammering patients are not there, but they are here, but they are not comfortable with the video. So I'll talk about the stammering as well. So as I told in the beginning, why stammering happen? When you speak, there are hundreds of our body muscles works. In a very coordinated way. If coordination among these muscles will not be there, there will be fluency problem. So stammering, I can say universal region of stammering is something lagging the coordination among the speech production muscles with the brain. So in the speech therapy, we try to coordinate all those muscles which are involved in the speech production. अगर पूछेंगे कि स्टैमरिंग के कारण क्या हो सकते हैं, तो मैंने तो इस यूनिवर्सल रीजन बोला, समथिंग लैगिंग द कोऑर्डिनेशन अमंग द स्पीच प्रोडक्शन मसल्स विद द ब्रेन. But I have seen some interesting example I will be explaining with the help of that. I have seen there was one patient whose grandfather was having stammering, son was having stammering, grandson were twins and they were having the stammering. What does it mean that? There are one certain gene passing from one generation to the next generation. The stammering can be genetic in origin. Next I have seen one patient was absolutely normal and his friend was having the stammering and he was teasing to him, and during teasing normal boy developed the stammering. So it can be what does it mean that? It can be a learned behavior. I have seen one patient who was absolutely normal, but he was emotionally attached with the grandmother and grandmother died, and after that he developed the stammering. What does it mean that? Stammering can be emotional in origin. I have seen few patients who had a history of head injury and after that they developed the stammering. It can be neurogenic in origin. This is the conclusion. So you can see the neurogenic, psychogenic, emotional, learned behavior, and even during childhood, from the age 2 to 5 years, speech language development among children will be very, very fast. They will be having so many things to speak, but they will be having limited vocabularies. So they will stuck at certain point of time, and the parents will think he's not talking in a proper manner. So they will start telling negative comments. Oh, why you are talking like this? क्यों ऐसे बोल रहे हो? ठीक से बोलो, ठीक से बोलो. तो पेरेंट्स के नेगेटिव कमेंट से भी स्टैमरिंग हो जाती है. तो फिर बड़ा मुश्किल काम है कि हम कैसे पहचानें कि ये स्टैमरिंग है और ये एक नॉर्मल नॉन फ्लुएंसी स्पीच लैंग्वेज डेवलपमेंट का फेज़ है. So if stammering is among children and if their age group is 2 to 5 years, it's more than 6 months, then only you should think, okay, he may be having a stammering. Otherwise, it may be speech language development phase. With the time, it may vanish. So I was talking about the stammering signs, symptom, cause, and treatment. And in fact, in treatment, we'll be working on coordination of speech production muscles. So which are those muscles? For example, in the beginning, I told speech production mechanism. For sound generation, what we need? Air pressure below the vocal cord. So first step of my exercise will be for a stammering patient, coordinating the diaphragm and intercostal muscle. These are known as breathing muscles. Then I'll be coming to the laryngeal muscles coordination with some exercise and breathing muscles together. Then I'll be adding the articulatory muscle like lips, tongue, jaw, and then I'll be coming to the conversation slowly, step by step. And then conversation with me, then to the outside world, then the group, like that, in the public speaking. So step by step. So something I told how do we treat stammering, like somebody is asking how to do the cycling, you are telling just hold the handle, put the leg on the paddle, press the paddle, but this is not sufficient. So once we work step by step, things will be more clear. Next is there any side effect of voice therapy or self-treatment? So voice therapy, there's no side effect of voice therapy if you are taking from a right professional, but if you are doing self-treatment by watching some videos in the social media, or you are taking treatment from the healthcare quacks, wrong vocal exercise or wrong way of doing right vocal exercise may damage voice and vocal cord and sometime permanently. And in that situation, people like me also not be able to help in certain situations, especially in the sulcus, vocalist, phonatory gap. These are also the result of the vocal abuse. Sometimes phonatory gap can be due to the vocal cord paralysis, but sometimes without vocal cord paralysis also they will be having phonatory gap, and the sulcus vocalist sometimes may be congenital and sometimes it may be the result of the vocal abuse. So vocal abuse means shouting, doing some wrong vocal exercise, smoking, whispering also, like my name is Sanjay. So these are the example of the vocal abuse, or speaking continuously without the drinking water. These are example of vocal abuse. If you are a teacher continuously taking so many classes without taking break, without drinking water, these are example of vocal abuse. If you are a singer singing with some different singer style, just doing some mimicry, that is also example of the vocal abuse. And the next is how to contact us. Our contact details are in the description of this video, so it's very easy to contact us. Next is, do we have accommodation facilities at our center? So at our center we don't have accommodation facilities, but our team will be helping you to get the accommodation. Next is, which treatment is preferred first, voice therapy or surgery for pitch correction? So based on my experience, my suggestion is first you should try voice therapy. If your body responds on the voice therapy, so it will be sufficient. But if you go for surgery, after surgery or after thyroplasty also you have to take the voice therapy. तो बिना voice therapy के सर्जरी अपने आप में अधूरा है. और फिर यहाँ पे एक चीज़ ऐड करूँगा कि आपने एक स्पीच लैंग्वेज पैथोलॉजी से ट्रीटमेंट लिया, सही डिग्री है, लेकिन फ़ायदा नहीं हुआ, तो ऐसा मत सोचिए कि आप वॉइस थेरेपी के लिए बने ही नहीं हैं. You have to find the expert who are really expert in the treating voice disorder, because speech language pathology is very, very broad. Everyone is not the expert of all the communication disorder. For example, I am not very good expert in the delayed speech and language, but I am expert in the voice disorder. Same way you can find out others also in which area they are very good, and depending upon that you should contact with that particular communication disorder. And next is, do we have any branch of our center? So till now we don't have any branch. Our center is only one, and the name is Sanjay Speech Hearing and Rehabilitation Center, that is located in Bangalore. When you do the Google search, you can find out easily. And even the link is given at our website, and website link is the description of this video, and even you can see here also our website. Next is cost and duration of treatment for voice and speech disorder. So the cost and duration, it varies depending upon the communication disorder. So we suggest, if you want to know the cost and duration, please call us. We do perceptual evaluation, then we will be able to comment on cost and duration. Next is, how do we treat international patient, online or offline? So we do treat our international patient in both the method, online or offline. And it depends upon what kind of communication disorder they are having, so that we decide after perceptual evaluation, and sometimes we suggest certain tests, for example stroboscopy or laryngoscopy. Next is saying 1, 2, 3 or saying in new voice is the stage of treatment or end of the treatment. So if somebody is having the high pitch voice, and once he is telling high pitch voice before treatment, 1 in the high pitch voice, next after treatment is saying 1 in the low pitch voice. So this we can say this is the stage of treatment, not the end of treatment. End of treatment means patient should be able to make the sentence fluently, he should talk. And there are so many videos in the social media, एक बार patient बोलता है पतली आवाज़ में, अगली बार आप बोल दिया मोटी आवाज़ में. So this is not the end of the treatment. Patient should be able to talk in a fluently, मतलब patient fluently बात कर सकें, तभी उसको end of treatment समझना चाहिए. For example, अगर आपको पहुंचना है दिल्ली, कोई आपको गाजियाबाद पहुंचा के छोड़ दिया, तो हम क्या कहेंगे? तो जो लोग 1, 2, 3 पे चेंज दिखाते हैं या आ पर चेंज दिखाते हैं, तो वही आपको गाजियाबाद पहुंचा रहे हैं, लेकिन आपका गोल गाजियाबाद नहीं था, आपका गोल तो दिल्ली था ना. तो ऐसे वीडियो से इंप्रेस होने की ज़रूरत नहीं है. एंड नेक्स्ट इज़ वॉइस थेरेपी रिजल्ट इज़ परमानेंट. तो ये एक वेरी कॉमन क्वेश्चन हमारे कॉल सेंटर पे आते हैं कि सर जो वॉइस थेरेपी के जो रिजल्ट होंगे वो परमानेंट होंगे कि नहीं. सो देयर आर सम कम्युनिकेशन डिसऑर्डर लाइक spasmodic dysphonia and stammering. After the therapy also we have seen some time relapse, but in the case of vocal cord paralysis or like high pitch voice, once we have treated till now, we have seen a stable voice in our patient. Even I was getting so many calls for this information, so I thought if I am telling and if I am giving the answer myself, instead of that, why not I should ask my old patient who we have treated 6 years back, 7 years back. So during COVID pandemic time, I was free, my patients were free. So we have done so many lives with our old patient to whom we have treated 6 years, 7 years back. And in fact, their feedback was their voice was stable, especially in the pitch problem, vocal cord paralysis problem, once the treatment was done. So my suggestion is, if you have such question in your mind, is voice therapy result is permanent? So explore our YouTube channel's homepage video, and usually in the comment box we recommend 35 minutes video, watch something like that. Description of that 35 minutes video, and you'll find all those links of our old patient to whom we have treated long back, and we did live with during the COVID pandemic time. Next is effect of food and drink on voice. So what we eat, what we drink, that affect our voice. In fact, if you are taking very spicy food, so what will happen during digestion, some acids will form, and when you sleep, that acid will accumulate near your throat, that may damage voice and the vocal cord. So avoid too much spicy food, and don't sleep immediately after your dinner. Have a gap between 1.5 to 2 hours between your dinner time and sleeping time to have a good voice. And if you are taking very cold thing, ice cream and very cold drink, so vocal cord is a kind of muscle, so during that time the natural shape of the vocal cord will be affected, so that may affect your voice quality as well. So if you are a professional voice users, avoid very cold thing. That is my suggestion. And announcement of next batch of group therapy. Already we announced our next batch of group therapy is going to be started on 1st July 2024. And next is, who are the good candidate for voice therapy? That is very, very important. So everyone is not good candidate for voice therapy, that I will tell. And if before coming to our center, if you are thinking it will be wastage of time and money, you are absolutely right. And if you are thinking after coming to our center, you will achieve something, you will be having a better communication, better voice, then also you are absolutely right. So before joining our center, think twice in which category you are. And is all high pitch voice or female voice is puberphonia? तो सारी हाई पिच वॉइस और फीमेल वॉइस प्यूरफोनिया नहीं होती है. सो प्यूरफोनिया लाइक हाई पिच वॉइस, फेमिनाइन वॉइस among boys is a kind of symptoms. Like for example, fever can be a symptom, but fever can be due to bacterial infection, viral infection, or maybe some other reason. The same way in high pitch voice, if somebody is having, so it is a kind of symptom, but it can be in normal vocal cord condition. It may be high pitch, maybe during muscle tension dysphonia, during phonatory gap, during sulcus vocalis. So you need to understand what could be the reason, and for that you need to consult a proper professional who are expert in treating voice disorder. तो सारी पतली आवाज़ प्यूबरफोनिया नहीं होती, इस बात को समझना ज़रूरी है। और प्यूबरफोनिया मतलब प्यूबर मीन्स प्यूबर्टी, फोनिया मीन्स वॉइस से रिलेटेड कुछ। तो जब किसी की एज अगर पतली आवाज़ वाले पेशेंट आते हैं, उम्र 14 साल 15 साल प्यूबर्टी वाली है, आई लव टू टेल प्यूबरफोनिया। बट अगर वही पेशेंट 55 साल की उम्र में आ रहा है, 55 ईयर्स की एज में, देन इट्स नॉट टेक्निकली करेक्ट टू टेल प्यूबरफोनिया। So high pitched voice or feminine voice among boys is a kind of symptom, and cause can be, and sometime in rare case there may be hormonal issues also, testosterone हार्मोन की कमी की वजह से भी रेयर केस में प्यूबरफोनिया हो जाता है, based on my textbook, but I have not met any patient till now. And online facilities for communication disorder at our centers. So there are few communication disorder for which we provide online voice therapy. For that we first do the perceptual evaluation, we suggest some tests, and then we decide who can be a good candidate for online facilities. And tips to keep your voice healthy, ये बहुत इंपॉर्टेंट है जिनको भी वॉइस की समस्या है या जिनको नहीं है। मैं अब जो बताने जा रहा हूँ, आप लोग अगर इसको अप्लाई करेंगे तो आप अपनी वॉइस को हेल्दी रख सकते हैं लंबे समय के लिए। तो ड्रिंक प्लेंटी ऑफ वाटर, वाटर इज़ अ वेरी गुड लुब्रिकेंट। फॉर योर वोकल कॉर्ड, तो वाटर इज़ अ वेरी गुड लुब्रिकेंट फॉर योर वोकल कॉर्ड, सो ड्रिंक प्लेंटी ऑफ वाटर। 10 से 12 ग्लास एक दिन में पानी पीजिए। अवॉइड फ्रीक्वेंट थ्रोट क्लियरिंग, बार बार ऐसे करना बार बार करते हैं तो वोकल कॉर्ड में फ्रिक्शन होता है, दैट में डैमेज योर वॉइस इन द वोकल कॉर्ड। विस्परिंग यू शुड अवॉइड, आपका नाम क्या है, कैसे हैं, so you should avoid, if you do the whispering that may again damage the voice in the vocal cord. Avoid shouting, if the background noise is very high then avoid to speak. And if you have voice disorder, any kind of voice problem for more than 2 weeks, so you should consult to a right professional. And do some jogging, walking, yoga, whatever you like to have a good stamina. If you have a good stamina, you can put sufficient air pressure below the vocal cord and then you can have a good loudness. तो कुछ फिजिकल एक्टिविटी होते रहनी चाहिए। ये सारी चीज़ें अगर आप अपनाते हैं, हाँ अगर आप टीचर हैं, इफ द क्लासरूम इज़ बिग, सो आस्क योर मैनेजमेंट टू प्रोवाइड एम्प्लीफिकेशन डिवाइस, ताकि आपको अपने वोकल कॉर्ड पे स्ट्रेस देना ना पड़े। तो बातें छोटी छोटी चीज़ें हैं, लेकिन अगर आप अपनाते हैं तो लंबे समय तक वॉइस को हेल्दी रख सकते हैं। एक देयर इज़ वन स्टोरी, देयर वाज अ गाय हु केम फ्रॉम गदक, इज़ अ प्लेस फ्रॉम कर्नाटका, एंड ही केम टू आवर सेंटर, ही वॉज हैविंग स्पास्मोडिक डिस्फोनिया दैट इज़ वेरी चैलेंजिंग टू ट्रीट। And when I was going through the history, what he told, he was having some throat infection, and for throat infection he went to the ENT doctor and he prescribed some medicine and he asked for the voice rest. So he misunderstood the instruction, and during the voice rest he understood like he can speak, and he was whispering for I think 1 month was the voice rest, so he was whispering for 1 month like aapka naam kya, say something, and he was having wheat flour meal, so he was working also and he was speaking in a whispering kind of style. So after the 1 month only whispering was there, and after that when he was trying to speak, the voice was coming very very challenging. I think if you go through oldest video of our YouTube channel, you will find that is spasmodic dysphonia patient. So it was very challenging to treat, very small improvement I was able to show that, and before coming to our center he met all the professional what exist in this earth. सो जितने सारे डॉक्टर होते हैं लगभग सब तरह के, इवन काला जादू क्या क्या मंदिर सबका जगह का वो चक्कर लगा चुका था, फाइनली किसी तरह मेरे पास आया, थोड़े इंप्रूवमेंट हुए थे, हमने भी हेल्प किया था उसको। तो कहने का मतलब ये है कि व्हेन यू डू द वोकल अब्यूज, हाउ इट्स गोइंग टू स्पॉइल योर वॉइस एंड द वोकल कॉर्ड, एंड विस्परिंग कंटिन्यूअसली फॉर 1 month रिजल्टेड इन टू द ओनली विस्परिंग, इवन द नॉर्मल वोकल कॉर्ड, ही वॉज हैविंग ए थ्रोट इन्फेक्शन, एंड बट बिकॉज ऑफ द विस्परिंग हाउ दिस प्रॉब्लम हैज़ एग्रीवेटेड। सो नेक्स्ट इज़ रिप्लाइंग द क्वेश्चन फ्रॉम द लाइव चैट। तो अब मैं फ्री हो गया हूँ, तो मैं देखता हूँ कि लाइव चैट में क्या क्या क्वेश्चंस आ रहे हैं, मैं उसका आंसर करूँगा। तो एक एक करके हम आगे बढ़ते हैं। पहले हम देखते हैं स्टार्टिंग में क्या सब क्वेश्चन है, उसका हम आंसर करेंगे। अभिषेक लिखते हैं, सर प्लीज़ कैन यू गिव मी ऑनलाइन ट्रीटमेंट फॉर प्यूबरफोनिया प्लीज़ सर। The basic session for you is please call us. We'll do the perceptual evaluation, then we can give the feedback. We can help you online or offline method, which method. And next is आकाश शाक्य लिखते हैं, ऑनलाइन थेरेपी चालू है, तो आकाश प्लीज़ कॉल अस, विल डू द परसेप्चुअल एवोल्यूशन। हम लोग परसेप्चुअल एवोल्यूशन करेंगे, फिर बता पाएंगे कि हम आपको हेल्प कर पाएंगे ऑनलाइन या ऑफलाइन मेथड से। एंड अक्षय आकाश शाक्य लिखते हैं स्टैमरिंग। ठीक है, कई बार पेशेंट जो है हमारे यूट्यूब चैनल पे कमेंट करते हैं कि मुझे स्टैमरिंग है, जब हम असेसमेंट करते हैं तो कुछ और कम्युनिकेशन डिसऑर्डर निकल के आता है। तो हमारा सजेशन ये है कि आप हमें कॉल कीजिए, हम परसेप्चुअल एवोल्यूशन करना चाहते हैं। स्टोरी बाय आलोक लिखते हैं, सर ऑनलाइन है प्लीज़ सर बता दीजिए। स्टोरी बाय आलोक ऑनलाइन थेरेपी हम लोग देते हैं बट लिमिटेड कम्युनिकेशन डिसऑर्डर के लिए, तो उसके लिए हम परसेप्चुअल एवोल्यूशन करना चाहेंगे आपकी प्रॉब्लम का। फिर नेक्स्ट है और स्टोरी बाय आलोक है, सर मेरा फर्स्ट टाइम है, मेरा फीमेल की तरह थोड़ा कभी कभी आता है। तो स्टोरी बाय आलोक अगेन आपके लिए यही सजेशन है कि आप हमें कॉल कीजिए, आपका परसेप्चुअल एवोल्यूशन करेंगे, फिर बता पाएंगे आपको हेल्प हम कर पाएंगे या कितना कर पाएंगे। कभी कभी हम लोग कुछ टेस्ट के लिए भी रिकमेंड करते हैं, जैसे कि स्ट्रोबोस्कोपी हुआ या लारिंगोस्कोपी हुआ। नेक्स्ट क्वेश्चन है, सर मुझे भी वॉइस का प्रॉब्लम है, लिखते हैं युहांशु देव आप हमें कॉल कीजिए, हम आपकी प्रॉब्लम को डिटेल में समझना चाहते हैं। रियल जर्नी, थैंक्स फॉर ज्वाइनिंग एंड वॉचिंग एंड थैंक यू ऑल फॉर ज्वाइनिंग एंड वॉचिंग अस, थैंक यू ऑल। रियल जर्नी लिखते हैं हेल्प मी सर, तो रियल जर्नी आप हमें कॉल कीजिए, आपकी आवाज़ को सुनेंगे समझेंगे, फिर हम गाइड कर पाएंगे कि हम किस तरह से हेल्प कर सकते हैं। तो जो लोग इस लाइव में जुड़े, मैं सबका तहे दिल से धन्यवाद देना चाहता हूं। और हम लोग 8 दिन के बाद पोस्ट ट्रीटमेंट लाइव होंगे, तो इन सारे पेशेंट की वॉइस में कितने चेंजेस हुए हैं उसको आप लोग ज़रूर देखिएगा। और भी पेशेंट हैं जो लोग की वीडियो के लिए कंफर्टेबल नहीं है, लाइव के लिए कंफर्टेबल नहीं है, तो उनको इस लाइव में मैंने दिखा नहीं पाया। तो थैंक यू ऑल फॉर ज्वाइनिंग अस एंड वाचिंग अस। और मैं उन सारे पेशेंट को एक बार फिर से दिखा देता हूँ, मैं कैमरा टर्न कर रहा हूँ, जो लोग इस लाइव में जुड़े और जिनका ट्रीटमेंट से पहले का वॉइस आपने सुना था, ये सारे पेशेंट्स हैं। तो और एक्चुअल नंबर ऑफ़ पेशेंट्स ज़्यादा हैं, लेकिन कई लोग वीडियो लाइव के लिए कंफर्टेबल नहीं है, वीडियो के लिए कंफर्टेबल नहीं है। तो जिन पेशेंट्स का आप लोग लाइव में देखते हैं, वीडियो में देखते हैं, तो सारे पेशेंट की परमिशन लेने के बाद ही हम लोग कर पाते हैं। थैंक यू ऑल फॉर ज्वाइनिंग अस, वॉचिंग अस, थैंक यू ऑल, लव यू ऑल।